Hi, everyone. Thank you so much for joining us today for this very important and powerful session. We are definitely excited to have you join us today as we'll be hosting a panel style Q&A session with some amazing partners that we have. So we'll go ahead and just give some folks to come into the room. And I see some folks are still coming in, so we'll get started in just a moment. Okay. Good afternoon, everybody. Thank you for joining us today for our The Power of Partnership Vaccine Access for DMV Natives. At She'e Zapor Bola Yunisha, Nakaidina and Inshla, Lok Adina Ebashichin, Tanis Setni Dashiche, Aro Turjini Dashanala. Hello and welcome. My name is Zipporah Fuller, and I'm the Director of Technical Assistance here at NCUIH. NCUIH is a national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. After months of barriers, urban Indians in the DMV will finally be able to get vaccinated. The National Council of Urban Indian Health and Native American Lifelines are pleased to announce the availability of COVID-19 vaccinations for urban Indians in the DC, Maryland, and Virginia metropolitan area. In partnership with the Indian Health Service and the University of Maryland, Baltimore, registration is now available for appointments in Baltimore beginning on Wednesday, April 14th. Since last fall, NCUIH and NAL have pushed for the inclusion of the 65,000 natives in the Washington, D.C., Maryland, and Virginia metropolitan area. As natives are dying from COVID-19 at the highest rates worldwide, NCUIH has advocated to the federal government to prioritize this population for vaccines. Today, I have an amazing panel of brilliant individuals that'll talk more with me about this. Today, joining us, we have Carrie Hawk-Lassard from Native American Lifelines. We also have Christopher Stanton with the University of Maryland, Baltimore. We also have Abhinav Bal with Uber. And so currently I'd like to start our Q&A session with Ms. Carrie Hawk-Lassard from Native American Lifelines. How are you today, Carrie?
I'm doing okay, and I am outside. Just want to apologies in advance. One of our community members passed away. We were doing a memorial service for her outside, and so I am outside. So please pardon the ambient noises.
Yeah, we're so sorry to hear that. Oh my goodness. Thank you so much for joining us today during this tough time. Our hearts definitely goes out to your community and to the individuals impacted. So thank you again so much for joining us. I wanted to just get started, if it's okay with you, if you could just talk to us a little bit about yourself and how you got involved with NAL.
Sure. Carrie Hawk-Lassard. My name is Carrie Hawk-Lassard. I'm the Executive Director of Native American Lifelines. One of my relatives was a student at the Carlisle Indian boarding school from the Fort Peck Reservation. So I am doing my best to use this lockdown time to learn the language that he wasn't allowed to speak. So thank you for allowing me to honor him in that way. Native American Lifelines is one of the Title V Urban Indian Health programs. Obviously, we are an outreach and referral, which means we don't provide direct medical care. However, we have case managers that connect individuals to care. We pay for them to receive care when that is necessary. We do have direct behavioral health services and dental services and other types of cultural programs for our community members. We do serve community members in the DMV. We're located in Baltimore, and we also have a program in the greater Boston area in West Roxbury, to be exact. I am a medical anthropologist by training, and my area of expertise is looking at the way that trauma impacts the contemporary health status of Native people and creating programs that bring that cultural loss into better relationship with the way that we live our lives now. So thank you.
Yeah, that's so awesome. You kind of touched on our second question here, but I mean, what does Lifelines do and how do you serve the urban Indian community? I guess more specifically, what sort of services do you have? How many locations? If you could provide more insight.
Sure. I would say one of the things that we feel makes us unique as a program compared to other programs that might serve natives, and again, not necessarily IHS programs in the area. But I spoke a little about culture loss, and based on research that I did and research that people in our community did, when you talked with folks in the local Baltimore community anyway, they 201 expressed that culture loss was a really significant problem for them, and one that they identified as being a factor in the health demoting behavioral practices with which they would engage, or just their lack of general wellness or resistance to engage in care. And so what I always like to say, and I come from an HIV prevention and treatment background, you can have a brochure about HIV and you can put a feather on it, or you could put kente cloth on it, or some other type of cultural signifier, but nothing inside that brochure changes. We try to invert that paradigm where we start from a place of indigenous knowledge and then bring the Western medical knowledge in on top of that. So our services truly are culturally grounded. We try to include indigenous language wherever we can throughout our programming and just in our physical spaces. So it's really making sure that we are truly reflective of the people that we serve and the needs that they tell us that they have. So instead of a top-down organization, we strive to be very much bottom-up.
Yeah, that's great. I know you've mentioned traditional services and like alternative healing. What sort of services do you have currently in that arena, or will you guys eventually get that if you currently don't have that now?
We do have some culturally based healing programs, mostly they're groups. Pre-COVID, people did have access to Inipi or Sweat Lodge through one of our community partners. Before COVID, again, we received a capital funding grant from the state of Maryland that would allow us to have just healing space, ceremonial space, a medicine garden. We hope that in the future we will be able to really have a space that incorporates those things.
Yeah, that's really awesome. I know that here in Arizona, for some of the community gardens that are here locally, some of the family medical providers are writing prescriptions to, have family members spend, an hour or two out in the garden or go out on a walk. So I think that's definitely really innovative. And speaking of innovation, how has your facility had to tailor and modify some of the way in which you used to work to COVID-19?
So we make sure we're kind of doing staggered telework. The local Baltimore folks, not all of them have access to internet, and and this doesn't characterize everybody we serve, certainly, but we do serve people who are unhoused. We serve relatives who are struggling with substance use, with domestic violence. So going completely telework is just not going to be an option for the people that we serve. So we have done sort of a modified telework schedule. There's someone in leadership on site all the time. One of the cool things that I will say is that, I mentioned we have a program in Boston. We've been able to work more collaboratively because we're doing our health promotion disease prevention activities online. And so it's allowing us to integrate our services better, but we're also able to access content providers that if we had to arrange for travel and things of that nature, it'd be really hard to do. And I'll give one example of that. In November, we were looking at food sovereignty in our community, and we put together a panel of language learners or traditional language or native language speakers talking about the ways that we understand our words for food, or how we talk about food, and how that relates to the relationship that we have with food in a contemporary sense. So we had someone from Seneca Nation, a friend from Pine Ridge, another friend from Ganawage. And so we had different language speakers being able to talk about the way their relationship with their indigenous language informs their relationship with food. And so it's allowing us to innovate in that way, that we have access to people we wouldn't have access to otherwise.
Yeah, that's such a great point. And I think that's also a testimony now to having our two partners on this call with us as well. So I think it's such a great opportunity. And of course, the last question is, how has COVID-19 impacted the community and your UIO? And it could be on any level. It could be operational, your staff's emotional well-being. Talk to us a little bit about that.
Yeah, I think, it's been tough internally and externally. Internally, we are doing a lot to try to serve community members, but we're also experiencing the pandemic ourselves. There's a lot more stress related to the work that we do. There's a lot more that we are being asked to do. And I don't know if people always realize what a small staff we have. We're about 11 people over two major cities. So, there's always a lot to do, and that's been stressful. There are people on our team that have family members in Alaska and they can't get home to their villages. That's difficult. I was supposed to go to Fort Peck for ceremony to meet some of my relatives for the first time. Wasn't able to do that. So, we are all very committed to serving our community members, but, we also have to acknowledge that our team members are suffering as well. So it's been hard. And I would say of our local Baltimore community members, what they miss most is meeting in person. That's really been a big loss for them that they expressed to us.
Yeah, absolutely. We just had a meeting ourselves, and what I miss is definitely the potlucking, the fellowshipping with your fellow colleagues and being able just to join together. And, we as Natives definitely love that. We've got the camaraderie happening, the jokes, the familial time together. So, yeah, thank you so much for your time, Carrie. We definitely appreciate everything that you're doing for our communities and the team as well. So thank you. At this time, I'd like to move into our Q&A session with Mr. Christopher Stanton with the University of Maryland, Baltimore. How are you, Christopher?
Hi.
So I wanted to just start, of course, out with, tell us a little bit about yourself and the University of Maryland, Baltimore.
Sure. Thank you all. I appreciate the opportunity to be here with you. Like, many of you in NCUIH, I'm driven by a belief in the inherent worth of every person. And I've been doing my best to be of service to others in the emergency management profession for the past 20 years. I'm also a relatively new dad, and I've got a feisty 2-year-old here at home. So that's been interesting during COVID. And I've got a new son on the way and due in June. And I would say that, despite many years of being in emergency management, which includes the fire department and stuff, you see a lot of good things, you see a lot of bad things, but parenthood really has changed the perspective of the world and the need, really the obligation to seek equity and compassion in all things that we're doing as a holistic community. So I mentioned I've been in the field of emergency management. I've been a volunteer firefighter and emergency medical technician here in Maryland, but I've also, some of that experience involves being away from the East Coast. I was involved in fire prevention and education with several Ojibwe tribes in Wisconsin and the Lakota in Pine Ridge, which also gave me a really different perspective than I grew up with. So now, as you mentioned, I'm with the University of Maryland, Baltimore. I'm the Deputy Director for Emergency Management. The University of Maryland, Baltimore is located in the southwest part of the city. We're just north of Ravens Stadium. And our mission is to improve the human condition and serve the public good of Maryland through education, research, clinical care, and service.
Yeah, that's definitely quite a lot. So talk to us about how that plays into the role and how you got involved with NAL.
Sure, yeah. So the University of Maryland, Baltimore, we opened the vaccine clinic in early January. We hadn't really planned on opening a clinic. There's lots of hospitals in our area. There's lots of resources, but just the vaccine demand was so significant. So we worked really hard. And we spent about 19 days to get it open. We opened in early January. We supported vaccination of those who met the age criteria, the job criteria for phase 1 vaccination. And then as vaccine became more available, we really wanted to continue to play our part in serving the Baltimore and Maryland community. So we entered into several partnerships with the Baltimore City Health Department, Mayor Scott's office, and then service organizations, which included Native American Lifelines.
Yeah, that's absolutely amazing. What sort of like impact did you guys see kind of in the communities that you served as well, more so specifically the indigenous populations there in Maryland?
I'm sorry, you broke up. I didn't hear your
Oh,
question.
oh yeah, I can definitely repeat.
Sorry.
So in terms of like the impact that your organization had seen and, you know, the need to be called on to help out in this and serve in this capacity for indigenous communities, what sort of other impacts did you see in which you guys were again moved to act?
Sure. Yeah, I mean, we're a university. We're not a healthcare provider as a like that. That's not really part of our mission, our day-to-day normal work. But you know, there was this huge need, this huge gap in the city, and so in the last 3 months, we've done more than 30,000 injections with just our small site. Um, and the vaccine clinic, we continue to be open now. So you know, at this time, the clinic is open and offering vaccine appointments to those who are, you know, a tribal member, descendant or spouse or partner of a member, or employed by an Indian agency, tribal organization, or even just those that work very closely with the Native American community. And we do continue to offer appointments to people who don't meet those criteria, but who live or work or learn in Baltimore. Um, and we've actually taken extra steps to serve persons who speak Spanish as their primary or sole language. And we actually are working to accommodate, we're pretty close there, and we're still implementing it in partnership with the mayor's office to accommodate persons who speak other languages and are refugees from elsewhere that have come to Baltimore. So, and just to make sure that I don't forget to say it, for people that are interested in getting an appointment, there's a website, www.gettheshotbaltimore.org. And people can directly schedule an appointment there. And for persons that don't have easy access to the internet, we also have a call center at 410-706-3000.
Great, thank you so much. And would a person who's coming in need to bring any documentation as well, maybe a letter of employment or tribal documentation at all, anything of that sort?
No. We really want to get shots into people's arms. So needing to provide that proof isn't a burden that we wanted to impose on people. I mean, we've had 8,700 Marylanders, of which nearly 1,000, just under 1,000 residents of Baltimore City that have been lost through COVID. And so, you know, we see vaccination as the important step to end this. So getting the vaccine is so important so that we, as individuals and as a overall community, adapt to strengthen ourselves, be more resilient for ourselves and our loved ones.
Yeah, and why do you think that is? Why would you say that it's important that we make vaccines available to our urban natives?
I mean, I think we're all part of an interconnected web of community, and so we go through our daily lives, we interact with a lot of different people, and it takes all of us to be protected against the virus so it doesn't spread among us.
Yeah, absolutely. I think there's definitely a really great effort and contributions coming from the American population currently. You know, the Navajo Nation has just vaccinated at least 70% of their population, back home as well. So I definitely appreciate that folks are stepping up. Is there anything else that you would like for our attendees to know today in terms of, things they should know before getting the vaccine as well? I hear sometimes the side effects can be a little daunting as well. And so I was always told, or I should say I was told, drink a lot of water the day before you come in and the day of. So any tips that you could offer to our attendees today?
Yeah, no, the drink a lot of water has been a very popular one that's helped people. It impacts folks in different ways, the shots do, but it really is a short-term thing. I mean, it's less than a few hours of pain for a really significant benefit. So it really isn't that big a burden.
Yeah, absolutely. I would agree. I think, one shot to save a lot. So yeah. Absolutely. Thank you so much for your time today. Definitely appreciate you being a part of our panel.
Thank you.
And so I definitely want to move it into the next segment here. And so when we think about access to healthcare, there are certain gifts we sometimes take for granted. The gift of transportation is one of them. Fortunately, we have someone on the call tonight who is part of an organization that is willing to step up and close that transportation gap. I'm pleased to announce that NCUIH has partnered with Uber to offer 2,000 free rides to DMV natives wanting to get their COVID-19 vaccine. Now, I can't see you all cheering, but I can feel it because this is exciting. Let's learn a little bit more about how this partnership came to be. Hello, Avinav. How are you?
Hi, I'm good, thanks. Yeah, it's a pleasure to be here. Thanks for having me.
Awesome. And so today we do have Abhinav Bal with Uber. So can you talk to us tell us a little bit about yourself?
Sure. So I'm based in Washington, D.C., and I work for Uber's social impact team. And at Social Impact, we're thinking through how can we use Uber's technology, our platform, our resources to support communities, and how can we show up for communities, especially in this time of need. And recognizing that transportation is often a huge barrier to access to healthcare, to economic opportunity. We're trying to, step up and do our part to make sure that people have a ride to their vaccine appointments.
Great, thank you so much for answering that. Can you talk to us a little bit about what is Uber's role in bringing access to urban natives in the DMV?
Sure. So, I think, the pandemic really has kind of laid bare the inequities in terms of accessing healthcare and opportunity. And, in the context of the COVID vaccine, there's a statistic that, transportation is often a huge barrier. Nearly half of Americans don't have access to public transportation. Millions miss medical appointments due to lack of reliable transportation. And so we kind of been thinking through how we can really bridge that gap. And Uber launched a global commitment to provide 10 million free rides globally for to and from vaccination centers. And so we're working with nonprofits, at the national level, as well as, local CBOs, and giving and donating rights to them that they can pass on into the communities in which they work in and communities that they're supporting to get vaccine access. And so, in that spirit and in that spirit of collaboration and cooperation and kind of recognizing that we're all in this together and we all need to do our part. We've worked with the National Council of Urban Indian Health. We are connected to them, and we were excited to see that they're setting up a vaccine access site at the University of Maryland, Baltimore. And so we thought, hey, this is an opportunity for us to plug in and provide free rides for folks in the DMV area to and from the location. And so we're super excited about this and happy to continue supporting both this effort, but also if there are additional sites that open up and are set up across the country, we're super excited to help and see how we can be helpful.
Yeah, awesome. What would you say some of the barriers were in trying to launch a project of this size and this kind of uniqueness, if you will?
So I think the challenge, I think fundamentally is because there's not a universal, model on how vaccines are being rolled out across the country. It's such a local effort. The distribution and eligibility, well, now I would, most folks are eligible, but given the fact that it's been in stages, and the fact that from city to city, from county to county, the way they are being distributed are so different. I think that has been one of a challenge that we're still trying to figure out and work around, right? And the question is, we have to be to make sure that the rides are being used and are getting to the folks that need them. We need to have these really local partnerships, and how you do that at scale across the country, recognizing the tremendous need, and now globally. I think that's the challenge, and that's the kind of nut that we're trying to crack, and we're trying to figure out who are the right organizations that we need to work with, especially organizations that have credibility and are working very closely to support communities in need and can be a lot more credible messengers of the importance and need to get vaccinated than we ever could be. And so, how we can provide transportation, how we can provide resources to get folks there, but who are the right folks that we need to be working with to make sure that, transportation is never a barrier to getting the vaccine.
Yeah, absolutely. And so how can I share information about Uber with my family and friends in the area?
So, so I believe we've passed on the essentially the way the rides work is there's a code that we've created that takes a certain, essentially gives you a free ride and takes the amount off your Uber ride. And if you enter that code, essentially you will get access to the vaccine. And so we love to work with the National Council over Indian Health to figure out what are the best ways to get the word out? How is it that we can help get the word out using our channels as well? Just to make sure that everyone knows that, if they need a ride, we're here to take them to and get the shot in their arm.
Great. And then where can I find some more information online to share?
Yeah, and so so there's our Twitter channel has kind of like updates on things that we're working on, new partnerships that we're launching. Our website, there's a section on it called Uber Newsroom, where there is a article about the initiative and how we're supporting and helping, and would love to if there are happy to share my contact information here as well, and folks want to schedule a conversation or they're interested in their organization, a member organization, getting a ride, we're happy to explore that and see how we can help.
Yeah, absolutely. Thank you so much for that information. And I wanted to also just take a moment again to thank you all for joining us today. That ends our Q&A session with the panelists. And what I want to do is let's go to our audience for a couple questions. Okay, and so the first question that we have coming up is, when did your partnership begin and how did it form? And that is a question to Mr. Christopher Stanton.
Sure, and I'll have Carrie help me out here. There's been several of us that have been involved in this effort. The partnership kicked off, the first vaccine of the partnership was provided on April 14th. And it's an ongoing thing with the clinic being open Thursday, Friday, Saturdays, and some Wednesdays, but definitely Thursday through Saturdays. We're open from 10 a.m. to 5:45 p.m. But in terms of how it kind of originated, I'm going to actually ask Carrie to speak on that. She was in it from the very beginning.
Sure. So this has been a very long process. It may surprise some people to know that Native American Lifelines and the IHS Nashville area office have been working on this since January, and not specifically with University of Maryland, Baltimore, but just finding a deficiency in the system. And what I mean is that as an outreach and referral, Native American Lifelines couldn't receive vaccine. We don't have any way to store it. We don't have medical providers to administer it. And so we were trying to find a way to make that work. And we had been in touch with other local partners, FQHCs in our area, to see if they would be willing to receive the vaccine for us. And what we would have to do is actually, me probably would have to drive to Richmond, Virginia, pick up the vaccines that were needed for that day, have the responsibility of bringing them back, and do that every time there was a clinic. And that just really was untenable. And I bring that up just so people understand the bureaucratic barriers that were in place. There was never a lack of will on the part of Indian Health Service, but just really just so many structural barriers in place to make this happen. We couldn't have a better director than Dr. Beverly Cotton. She has been amazingly supportive in making things happen. Jen Downs, our urban area coordinator at the Nashville area office, helping us to broker this relationship with University of Maryland, Baltimore. When it was decided that IHS would allocate trays of vaccine directly to UMB, that's when the process sped up. It's just, timing is an interesting thing. Everything got into place just as our state was opening up eligibility to basically anyone who wanted it. I served on Maryland's vaccine task force, and one of the things I think we assumed at the beginning incorrectly was that there would be more hesitancy than there was. I think, you know, in 2020, we assumed that there would be more hesitancy, and finding out that that wasn't the case and we really needed to get shots into arms, we started acting immediately, but just the bureaucratic parameters made it incredibly difficult to do. I'm so grateful that it's working now, and it's very easy to schedule.
Awesome. Thank you so much for that response. We have another question coming in from the chat box. It states, has the response from the DMV Native community been a success?
I saw that in the chat, and I was just writing back, but I'll say it here on the call. So what we have 200 appointment slots available open for this tomorrow. Today, Wednesday. For this week, we have 200 slots for next week that are set aside. We do have availability for folks to continue to schedule into those slots. What I was going to say is that I don't have on hand how many folks have specifically gotten vaccine over the last 2 weeks. I just don't have that on hand right now, and I apologize.
Yeah, no worries at all. Thank you so much for answering that. I think another question that stems from that too is, you know, the notion that a lot of folks aren't returning back for their booster shots. A little bit of advice on that as well, like why it's important to go back to get your booster. If you guys could share on that importance.
Yeah, the booster. I mean, the booster is very important to help build those antibodies. The first shot only gets you partially there. And so you need to wait at least the several weeks. Moderna and Pfizer are a little bit different in terms of the number of weeks you wait. But you wait 4 weeks or so, you get that booster, and then your body is far more protected than if you only got the second shot. And for anyone that is concerned, they've heard, oh, the second shot makes you sick. It really is just sick for a few hours. That's definitely a cost worth bearing for the significant increase in protection that you get by the booster.
Absolutely. And then in terms of like vaccine, one question came in about which vaccine should I choose? Which one is best for me?
They are both extremely great vaccines between Pfizer and Moderna, which is what we're doing at the UMB site. To the point that, I mean, we're talking about 94% is, the rate of protection against, serious illness and death. If you compare that to other vaccines like flu, it's way above what those other vaccines are doing. So, to say one is better than another really isn't something you should be worrying about. I mean, think about all the vaccines that you've probably gotten in your life. Have you ever asked, which manufacturer it was from, or really compared? I mean, these are excellent vaccines, and I would encourage you to get the first one that's available to you, and certainly not worry about trying to pick one over the other.
And I will share that IHS allocated the Pfizer vaccine, so that is the vaccine that is available to our community members. We have had a few people who have already gotten a first dose somewhere else, and we have worked with University of Maryland, Baltimore to make sure that they can get a booster shot. That is very important. If your first dose is Moderna, that your booster needs to be Moderna as well. We are, again, Pfizer is the vaccine that IHS provided to University of Maryland, but if there are special circumstances, we invite people to reach out to Native American Lifelines, and most of the time we can work out something to get taken care of for you.
Yeah, I concur. I mean, our site currently does have Moderna too, so we would rather a shot be given than not.
Yeah, absolutely. And then another question coming in is, what can I expect once I show up for my appointment?
Sure. So the building behind me, it's maybe hard to see, I'm kind of blocking it, but in my background is the building that everyone enters through. We have greeters there that greet everyone and then just make sure that they aren't having any symptoms of feeling ill. There's a very short queue line. I mean, we just do not have the queue lines that Other sites have. People wait, either they don't wait at all, or maybe they wait up to 15 or 20 minutes to get through the queue line. You register with a registrar, you go to a vaccinator station, get your injection, and that might be 3 to 5 minutes. And then at UMB, we welcome you to wait in an observation area. Most people are waiting 15 minutes. For the very small number of folks that have past medical history that indicates it, they wait up to 30 minutes, but most people are waiting 15. At the site, we have music, we have snacks, we have drinks, we have a comfortable waiting area with windows, and then Carrie and her team have a table there on on certain days just to provide additional information while people are waiting. We do have our site is convenient to folks that want to walk up, want to take public transit. There's a parking garage that's connected. For anyone that's in need of having that parking fee covered, we would rather cover that for folks when they come get their shot than that be a burden. Carrie, is there anything else you'd like to add in terms of things that you guys are doing?
Sure. Yes. And I will say, having been vaccinated somewhere else, this is really an efficient process. It's a quick process. It's a friendly process and so well organized. So I've been really pleased with that. When people receive their vaccines, when they come out, our table is immediately there. And, we've got a big sign up with thank you in lots of indigenous languages. You can't miss us. And we have little giveaway bags just to thank you all for being a good relative and being vaccinated. But we can also answer any questions about our program. We realize there are a lot of people who have lived in the DMV area for a really long time who have never engaged with our program for a variety of reasons, but sometimes are finding out for the first time that we do have services that would benefit them. So we're on hand Thursday through Saturday to make sure that we're able to answer any questions that people have. I would also encourage, we've had a few situations where people have struggled with scheduling. Our team at Native American Lifelines can help you to schedule. If you have elders or other folks who just have a difficulty navigating the internet, happy to do that for them. And then we can troubleshoot day of. We're always in communication with the team on site at UMB. I'm typically there on Saturdays, other team members, other days of the week, but we're constantly in communication to just try to make it a smooth and easy and friendly process for all of our relatives coming through the system.
Yeah, absolutely. Thank you so much for that. And Abhinav, what would the protocol be for the Uber ride? Would the drivers wait, or what does that process look like?
Yeah, that's a great question. So essentially, the way we have set it up is if you enter the promo code into the Uber app, it's essentially good for one ride, so from home to the vaccination center. But we recognize that you need, if you're doing the Pfizer or the Moderna shot, you need, 4 rides to get your full course of vaccination. So we've taken that into account, and essentially all 4 rides would be free. But you'll have to enter the promo code each time you use it to get to and from or from and to the vaccination site. And essentially it's just like a regular Uber that, you get into the car and then you get dropped off at the vaccination site. And then to get back home, you'll need to order a new Uber ride and then again enter the code and take you there. And so that's kind of how it works.
Great, thank you so much for that. And as I understand it, folks will go, once they register for the shot at UMB, that code will then be given to them, and they'll be able to take Uber into the city or wherever they're currently at as well. Yes, and so there's another question coming in. What is the promo code? Is it set to expire per account? And again, as mentioned, that code you will get once you register for a vaccine appointment with UMB. And we can go ahead and put that into the chat box. One of our amazing comms people can put that in there. And Christopher, can you repeat that UMB website one more time so we can get that into the chat box? Perfect, thank you so much. Yeah, exactly, thank you so much, sir. So folks can go ahead and head there, register for their COVID-19 vaccination, and that code will appear. And again, for the next question, is it set to expire at 4 per account?
Yeah, so essentially the promo code would work. You can use it 4 times on one account because it's for an individual user and for an individual user's course of vaccination appointments. And that's how it's been designed. And the expiration period, I believe it's valid until September. You know, I'm not quite sure how long the vaccination site's going to run, but we wanted to make sure that, you know, we're not making this available just for a very short amount of time.
Yeah, that's a great question. I think a lot of folks are anticipating, hopefully, beating this through all of the vaccine sites and what have you. I think there's definitely room for opportunity there, and waiting to see, you know, what's set to occur. And I guess that's leading to our next question. And what do the 3 of you guys anticipate in the upcoming months as it pertains to COVID-19? And I don't know who wants to go first. I know there's been a lot of talk around like mental health services also being on the rise, I think, for this latter half too, and really trying to get folks to also get in for their preventative maintenance as well, you know, the well woman. So yeah, what are some of your guys' thoughts?
Yeah, you're completely right. We have noticed that we've had a more higher demand on our telebehavioral health services. You know, and again, with people working at home for such extended periods of time, we've seen people who've been in extended recovery, you know, lose that. People are now at home in situations that could become or are domestically violent, and those are, I think, things that you don't necessarily think of at the beginning, that now, you know, everybody's all under one roof, and that can be really stressful. So, you know, just encouraging people to take advantage of the telebehavioral health services, but also not neglect the regular preventative care that needs to happen. And so if there are individuals that don't have a primary care provider, again, there is no IHS hospital or clinic in this area, but our case managers can work with folks to get them connected with medical care. And if making payment is an issue or co-pays are needed, we can work that out. And we certainly have the budget to take care of those things. And we also provide transportation for people to get to their medical appointments, so that is not a barrier to care for them. So.
Great, thank you. Any other comments about the Uber industry coming up, or even from University of Maryland? Any trends?
No, I think for us, it really is, I guess, the question is, how do we get more folks to and from vaccination centers? And you know, we'll defer to the experts to see, you know, what's the pace and how that's slowing down, and then, you know, what is needed in order to do that, and recognizing, you know, where we might be able to help with transportation, and what's the best way that we could plug into efforts on the ground by understanding how this is playing out locally, and how, you know, community leaders, you know, nonprofits, healthcare workers and clinics, etc., how they kind of trying to get past, I think, you know, the folks that who are already being vaccinated, and folks who might be hesitant, or folks who want to get the vaccine but they don't have the means to get there. And, you know, how do we really continue to keep that momentum going? And if there's anything we can do, you know, we're happy to help, and want to learn and listen to folks on the ground and what the needs are.
Yeah, absolutely. I totally agree. I think there's room for just a lot of growth and innovation coming up within the next couple months. Christopher, do you have any other additional comments you'd like to add with any forecasted trends within your organization?
Well, I'll speak to that. There was a question in the comment in terms of how long the partnership is anticipated to last. And actually, I'll just speak more broadly about the vaccine climate. And I really speak specifically to Maryland and the Baltimore region, because I know it is very locally dependent. But within Baltimore and sort of at Maryland level, we're seeing there's actually more doses and appointments available than people willing to be vaccinated. A large Maryland site is the Raven Stadium, and my understanding is that's going to close by mid-July. And like I mentioned, you know, we have 200 slots set aside for Native American Lifelines group that actually aren't being filled. So we want to vaccinate everyone that's interested, but people that maybe are on the fence and haven't scheduled their appointment should certainly do so. And I know that early on it was a only people at very advanced age or closely involved in the healthcare industry, only they could get vaccine. And there was a mindset among a lot of people of, I don't want to jump my place in line. And that mindset should no longer exist. There is plenty of vaccine, there are plenty of appointments. No one should feel bad about getting vaccine. I had someone I'm associated with said that to me last week, and it's like that just doesn't exist. The paradigm of COVID has shifted again. So people should really get out there and take advantage of the appointments really before things close back up. I mean, Raven Stadium is closing because we want to get back to NFL, and a lot of these mass vac sites, including at University of Maryland, they aren't dedicated healthcare facilities. They have other uses, and so I think that's something we may be seeing. That being said, I don't currently know what COVID boosters might look like. I think that's something that we need to keep our eyes open for, about in the fall, kind of going into maybe I don't know a specific duration period of time in which people might start needing boosters, but there could be a third shot somewhere in the future.
Yeah, absolutely. And thank you again so much for all of your comments. I'm just checking the chat box as well, and I see the comments coming in about data and how we're going to be counted. And I think that's also another kind of can of worms when it comes to, the American Indian count. What does that look like kind of into the census? Are we getting accurate numbers from all these multiple entities and organizations that are providing vaccines as well? And so I think that's going to be another hot topic coming down the road is, data equity. As it pertains to the American Indian population. So that's going to be another key item. Yeah, I definitely wanted to just thank you all and just really trying to, again, serve our communities in what capacity that you can. I know we've lost a lot of people to COVID-19, and it's just been a very traumatic experience. Again, not just for us and those that we're losing, but also for our children. And so I'm really, thankful that you guys have stepped up to the plate to offer your services and your expertise to, the DMV area, and also to any attendees here today that are not a part of the DMV area. Thank you guys so much. And that ends our Q&A session with the panelists. If there are no other Q&A questions coming into the chat box at all, I'm just going to give that a moment. All right. I think everybody's again asked all the questions that they could. And again, thank you all for being such an inspiration and brilliant people. Abhinav, Christopher, Carrie, thank you so much for serving my people and our communities. I hope everybody has a great day today. Thank you.
Thank you.
Bye-bye.
Thank you.